Hello, Rebecca Seiden here with Sterling Healthcare and Life Sciences. Working with large pharmaceutical and medical supply manufacturing clients, we understand that their needs for pre-employment screening can be super complex. The pressure to recruit and hire top talent safely and efficiently has never been more urgent. If you're experiencing this pressure, I want to quickly share two key considerations that have been coming up more frequently. First, and perhaps not surprisingly, large life sciences companies generally have global screening needs. Many of our clients have locations around the globe and need the capability to perform background checks, employment, and education verifications in those markets. And oftentimes, companies believe they are performing complete global background checks, but when you dig a little deeper, are actually reviewing global database searches. These can be a useful resource, but they are broad and high level. A search like this may not be enough for your company. If that's the case, it may make sense to partner with a background screening company who has teams on the ground in the regions where you have facilities so that they can provide you with regional expertise to help you navigate complex regulatory and business issues. For example, at Sterling, we have teams in the US, Canada, EMEA, and APAC. We have screening and compliance solutions covering 195 countries, and as a result, we're able to provide candidates with a simple, regionally relevant experience. The second consideration I want to mention is about contractor programs. The life sciences companies that I've worked with feel very strongly about ensuring that not only their employees are thoroughly background screened, but that anyone working with them or on their premises is also screened at this level. These physicians often have access to secure facilities and interact with patients, staff, and other vendors. You may take on unnecessary risk if you don't apply the same screening principles and standards to your contractor programs as you do for your own employees. However, it can also be a huge administrative headache to establish screening policies and have each contractor manage it themselves. Our best practice recommendation is to find a provider who has a contractor program in place that can centralize screening and take it off your plate. If you have any questions at all, we would love to help. Feel free to reach out to your client success partner directly or to our team at sterlinghealthcare@sterlingcheck.com. You can also find us at sterlingcheck.com/healthcare. Thanks so much for watching.